Howdy, Cape Codders. My name's Steve Scannell, and today's show, number 48, is entitled The Drugs with J&B. And today's date is January 19th, 2016. So welcome to the Scannell Agenda. What is J&B? Okay, that stands for Job and Bunk. So I'm proposing that we do this town nurse-based system. And folded into that system is going to be the Job and Bunks, Clubhouses and Job and Bunks, to take care of some of the loose ends, as they are called once in a while. Oh boy, this is a tough issue for me because on October 26th, 1975, I committed a vehicular homicide, and I was smoking the grass. So I am guilty of a vehicular homicide, and I lied my way out of it, handled it very badly. I was afraid to go to jail. Bad character. I think the same person can also be responsible for good character and turning their life around. It's called redemption, and it is possible. It makes it tough, though, if you're so far into the drugs. And by the way, the drugs, these are older people who used to talk like this, the drugs, or he's into the drugs, or she's into the drugs. And these would be, when I was a kid, these older people would talk about, you know, the whole controversy of the drugs, and they would call it, you know, they didn't know much about the marijuana or the other drugs here on the Cape. It was all, I think, to my parents, something they didn't have experience with. So when marijuana came along, you know, this big controversy. I guess, I don't know if I should say this, there's only 2 of us left in the family, but 5 of us kids actually smoked the grass, you know, to one extent or another. So we were all into it a little bit. And I think a lot of families, let's say we're an Irish family, Irish Catholic family, we knew how to have a good time, how to have a few drinks. I never went overboard on the drinking too much. I kind of stuck to the marijuana. The funny thing with me is that, and it's true with a lot of kids, I think, is they think that the marijuana is okay because it's better than the alcohol. So that's as my grandmother would say, you can't put an old head on young shoulders. All right, so I'm going to read a little editorial here. So this is Cape Cod Times, Friday, January 15. This is in the editorial section. And I actually haven't read this, but I skimmed through it. And here it goes. Why the Heroin Documentary Succeeds. And I haven't seen that documentary. I'd like to say I wouldn't like to see it, but I suppose I will see it, okay? Like I have a duty to see it. Now, here it goes. Why the Heroin Documentary Succeeds. Some criticism has been leveled at Heroin, Cape Cod, USA. The HBO documentary that follows the lives of 8 young Cape residents struggling with heroin addiction. All right. Many people are upset that the film focuses on Cape Cod, the fictitious land of nirvana, and some have said that it exploits addicts for no good reason aside from improving HBO's bottom line. People have also complained that it provides no solutions. Well, I didn't see the film. Keep in mind, however, that the screening at Cape Cod Community College on December 17th drew enough audience members to fill the Tilden Arts Center's 657 seats. Never in the 6 years that the Cape Cod Times has covered the opioid epidemic has that many people come together to learn about this issue. After the screening, 4 of those featured in the documentary, Dan, Collie, Ryan, and Jessica, and parents of addicts, took the stage and discussed their struggles. They openly explained their reasons for participating in the film, saying they wanted to help the nation understand this problem as it truly is. They put themselves out there so that parents, legislators, school groups, and advocates can make informed decisions and push for effective changes in the healthcare, pharmaceutical, criminal justice, and drug treatment institutions. The audience at Tilden reacted with wild applause and standing ovations when Dan, Collie, Ryan, or Jessica spoke. "This film has nothing to do with me," said Collie. "It's to let people know we are human beings. Every human being deserves," end quote. "Every human being deserves love, and seeing those young Cape Codders always on the edge of crime, madness, and death will make audiences care. The solutions are not mysterious. Treatment works, but there isn't enough insurance coverage to provide it. Prevention isn't enough insurance coverage to provide it. Prevention works. We just need to be committed. We need to care. The HBO film makes people care." All right. So, treatment works, but there isn't enough insurance coverage to provide it. That seems to be the mantra with a lot of people. Treatment. Well, I'm from the jail school, so I disagree with the treatment, unless it is in jail. And I have been in jail, so I do know that treatment in jail, number one, keeps a person dry, keeps them fed, keeps them out of everyone's hair while they shape up, or, as it were, while they be corrected. Prevention works. We just need to be committed. We need to care. Well, that can be said of the jail scenario, which I would be in favor of, and I would be strongly in favor of taxing the bloodstream, taxing opioids or cannabis in the bloodstream. I think that is the way to go. When you get a physical, you get your blood test, and then you get a drug test. And you may get random tests if you're high risk for drugs. Now, this can work in a person's favor too. If you can demonstrate that you are clean and free of the drugs, if you're looking for a job, well, you may be at the advantage. Even if you've had a history, or even if you've slid and gone down the wrong path in your life. So, now, the town nurse-based system and the J&Bs. I believe in having clubhouses embedded into the jails all across the country, because a clubhouse is basically, it's to societal organization for people with problems and disabilities what the town meeting system is to democracy. It's very basic, and it does work, and it's well proven, as is the town meeting system. It's that good that I would compare the two. Now, with the drugs, it would help if we had a national priority for good food and to work on the bad soil that we just talked about, that I just spoke about in the last program. Because it's all about putting people to work, you know? In fisheries, if you don't have people working, you've got a lot of people that are suffering. And people that are suffering are going to possibly weaken and do the wrong thing, get into drugs, drinking drugs. No, I'm not saying it's a sin to have a beer once in a while. But, you know, as they say, moderation is important. Now, having said that, a lot of people have moderated the use of their heroin habit for many, many years, and we don't even know who they are. And in Great Britain, they did a documentary that I saw years ago about the medical uses of heroin, same thing, for hospice care of cancer patients, and I was quite impressed. And heroin's a natural drug. I guess they grow it in Afghanistan. Who's in charge of Afghanistan? So the production went up like 5 times since we arrived over there and said, we're here to do whatever we're doing. But one of those things was the production of the heroin or the poppies went up. If they say 5 times, it probably went up 20 times. So, and I did mention I lived next to a drug house for a long time, and it was horrible. So taxing the bloodstream for marijuana, so let's legalize marijuana. I say no. Give it a fee and a fine, a fee fine of a certain amount of money. Don't make it too onerous. And, you know, that would do the trick. A lot of people would not want to be on the list for being a druggie. Now, I know that doesn't sound American to you, but neither is this country right now. The way we're going with all these, you know, mollycoddling all these drug people, and we're going to do this for you and that for you, and it's like tax money grows on a tree. You got to be kidding me. This is illegal use of drugs. The drugs, you know. Now, as far as the drug treatment goes, why do people think, this is a question I have, that people don't belong in jail? Oh, no, 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 we're not going to put you in jail. Jail is like jail's this big. Okay, jail is good. Jail is a correctional institution. Jail is where you belong if you're having some discipline issues. Now, if you're getting into the drugs, then you have definitely got the discipline issues. All right, you definitely do. Now, do you have a disease? No. You've got a discipline issue. You can't have a disease called alcoholism or drug addiction. That's absurd. Just because it gets repeated, it's just the most absurd thing, really. So the addict, a legitimate ward of the state, question mark. Is the addict a legitimate ward of the state to you? Well, to me, I'm in the minority, apparently. Maybe a lot of people like this kind of thing that was in the paper about, you know, we have to care, all that rubbish. All right? Because you're saying, okay, I don't care. I do care. I've been in the recovery business, heavy duty, for many years at Bay Bridge Clubhouse, so I do care. Now, it's a drop-in center now, but we used to be in a recovery assembly line. Unfortunately, Governor Deval Patrick, I think he got swayed by the shrinks, and he ruined it. And the Clubhouse model is worldwide. And Governor Deval Patrick just did not have the good sense that God gave a head of lettuce. And I think his wife's mental illness probably allowed the shrinks to come in and command him to do things that should not be done. So I'm hoping Governor Baker has a little bit more sense than Deval Patrick. So, is the addict a legitimate ward of the state? I say no. The addict is the archetypal, reprehensible character. These drugs are illegal, folks. Let's not forget that. You're doing drugs, you're doing illegal drugs. It's against the law. So maybe you don't have work and you're a ne'er-do-well, and if you're on drugs, maybe you're not going to get a job because people don't want you. Maybe you were a tail chaser and a drinker when you were in 7th grade and you just never stopped. Maybe you're just a tail chaser. And maybe you're not working, you're doing drugs, you're a good time Charlie. That's another. Invective or village idiot, my favorite. You could say village idiot. The word idiot could mean illicit, drug, induced, occupational taking. And I have a village idiot project that was anti-marijuana and tobacco, and that went with my Sunday school project years ago. It actually went to the Nantucket Town Meeting. And I had done a TV show on it, and I explained it all in detail to people. It was a 4-step system to put the tobacco issue to bed. It's still on the table as far as I'm concerned. Still a good system. Economic systems that I devise using political algebra. That would be a classic. I called it the Village Idiot Anti-Tobacco Tobacco Company, where you would grab the market share for the tobacco industry. You'd actually kind of be the anti-missile. You'd start a company that sold tobacco products. You'd team up with the cigarette smokers and the kids. You'd grab market share, and then the governments of the world would buy out the tobacco companies of the world, and then you've got the bull by the horns. Then you can control the nicotine, and you can control the advertising, and you can phase it out. Just phase it out. I say slow and steady, nothing too ridiculous. You know, you don't have to be shocking anybody's system. And believe me, the tobacco companies faced with a situation where their market share is going down would readily and agreeably sell out. So there's nothing stupid about my systems at all. They work, I think, if you would look at them and model them up. So that was my first drug system. So I'm down on the drugs because I'm down on myself partially too. You might say, you know, well, I don't like myself because I did a bad thing. Well, that's true. But I do love myself because, you know, child of God and all that. And I believe in redemption and forgiveness, and I believe people should be straightened out and put on the path again and move forward. That's not just for me, that's for all of us. I think that's the way to go. That's Christianity too, basic Christianity. So I don't think it's a case of anything referenceable to a disease, as the paper would, you know, and so many people are on this kick about, oh, it's a disease. What was the last thing I heard? Was it was a neurological disorder. Addiction, a neurological disorder. And boy, I just have to say, oh my God, we're really prime. I mean, come on. That's just mind-blowing, really. So these discipline cases are a problem, and there's nothing new under the sun. Now, diseased people, that is mentally ill people, are in no way close to being societal offenders. But we, the mentally ill, and as you know, I deny my mental illness about 7 of them, because I think it's absurd. I'm just a political activist, but I am diagnosed. So I say we, the mentally ill, always want to fight stigma, because, you know, you can't help it if you show up and your wires come loose in your head. You just can't help that. And that shouldn't be put on you. There shouldn't be stigma. We should all help each other. But, you know, if I showed up in the emergency room And I had an ice pick in my right hand, and I attacked my left hand with the ice pick. The doctors would not appreciate that. No one would appreciate that. Do you want to fix my hand? You know, it's ruined. Well, the brain, the hand, same thing. It's all about self-abuse and self-discipline issues. So we shouldn't be painting this picture of addicts being diseased. These people need to go to jail, and they need to recover while they're in jail and while they're working in jail, building boats for building aquaculture gear and fisheries gear. There's plenty of things for people to do. And with the drug testing, you know, I knew a guy who had to go to jail for a year because he had a beer. That blew me away. No, I'm not talking about anything onerous, but some people, a lot of people, not a lot of people, some people just need a firmer hand, or else they're going to go off the path, go off track. So I just think these systems that we're using now allow people to go way off the track, and it's really bizarre that we're letting this happen. And I think we ought to think about, you know, mental illness as a disease, but not addiction and addictive behaviors. Well, I know there's some overlap, there can be some overlap, but let's not prime the pump. That's ridiculous. So I find the addict to be offensive, and that includes people with, you know, cognitive problems and mental illness. You know, if it's your answer to get into these drugs, then I find it offensive, because I want everyone pulling their weight. Now, here I am, you know, prime offender, prime druggie offender, talking like this. So I have no right to say anything. I really don't. But here I am anyway. So the laws of the land should count for something. Notwithstanding all this money being made from the drugs, we shouldn't be handling this as, you know, sick people. People can be weak, very weak, but sick, I wouldn't say it's a neurological disorder. I wouldn't say it's a disease. I would definitely categorize it as a jailable offense to society, and we ought to go back to that. And there's nothing wrong with having a wonderful jail with wonderful guards, beautiful people, working with people. And, you know, we had the farm on Barnstable, and, you know, that was very good. And good food, you know, I think there was a lot of recovery there. Now, I've never been in the new jail, but I have heard bad stories that it's kind of like state time, doing state time. That's not good. That's not good. You want to handle your small-time offenders gingerly. You don't need to beat them up and put them in state jails for these little offenses, but you do want to get people dried out. And you do want to drug test and nip it in the bud. Drug testing would be responsible for about 70% of the answer, I believe. If we were to look at it as, you know, good identification systems, drug testing. We're going to be into medical systems now that are more onerous, you might say. So whenever I go to get a physical, I get the blood work done. I don't take any drugs. I've never had a psych pill in my life or any psych meds in my whole life. I just think there's a lot of passive-aggressive people in the psych industry that don't belong there. There's a lot of destructive people in that industry that hurt a lot of people. So the last thing you want for your family is, if you have a druggie in the family, is to put him into the... I'm not going to go there. That's not proper for me to say that. I'm sorry. Now I'm going to get into J and B. Job and Bunk would be attached to the clubhouses. So if you find yourself wrecked from the drugs, alcohol, what have you, then you may find yourself in a clubhouse. Now I would say the Job and the Bunk would be just a nonprofit where you can be shepherded, you have a job, you have a bunk. And that's about it. You don't get a paycheck, you might get a small stipend, but you're going to be handled and all your affairs are going to be handled. And you'd be willing to get a grub stake up and move out, that'd be fine. But a lot of people don't rise to the occasion of the full boat psychiatric care, and that's what they're getting. And a lot of these people are drug cases and alcoholics that get into the psych system, and I'm kind of offended by that because it's tax money, and we shouldn't be doing that. Now, the money is partially it too. You know, we can't be spending all this money going down this business of mollycoddling everybody, because it's just gonna create more dependence. And if we say to people, you'll be a ward of the state. If you get into drugs, you have a disease. We're just going to be actually creating more. And I saw someone presenting that worked in a school, and I thought it was a situation where she's given very bad advice to the children about this business of it's a disease. Very bad advice. Kids pick up on that and they say, oh, a disease, oh, so I'm not the bad guy. No, no, no. Gee, that's wrong. I think we're painting this picture that the government and these programs should do everything for everybody. And I really don't think it's a great idea at all. We're going down the wrong path here. So the addict, to me, is not a legitimate ward of the state. They belong in the Job and Bunk program, which I've explained to you as a simple job with a bunk, and someone's over you, and they're going to tell you what to do and what job to go to, and you're going to be drug tested. But clean this mess up. Thanks for watching the Scannell Agenda.